Welcome to episode 82 of Leaders in Healthcare. Today, we sit down with ophthalmologist and co-founder of the Canadian Women in Medicine organization, Dr. Setareh Ziai. We're gearing up for the 9th annual CWIM Gather event, happening this June 11th to 13th at the RBC Convention Centre in Winnipeg. Born out of tragedy in 2018 to honor Dr. Ilana Frick, this conference has blossomed into a profound movement. You won't find lectures on clinical guidelines here. CWIM Gather is fiercely dedicated to physician wellness, personal development, and deep camaraderie. It's a beautifully unique space where women physicians gather to support one another, fill their cups, and hear from world-class speakers like Dopamine Nation author Dr. Anna Lembke. Whether it's the surprise awards or the overwhelming sense of community, Dr. Ziai's advice to anyone on the fence is simple. Take the plunge. Discover what makes this the best medical conference in the world. Now, let's jump into the episode.
Dr. Ziai, thank you so much for talking to us today. I'm excited to learn a little bit more about the Canadian Women in Medicine and the event coming up this summer.
Thank you. Thanks for having me, Jordan.
So we're looking at middle of June here, June 11th to 13th, and we're going to be in Manitoba this year.
Yeah, it's our first time in Winnipeg. We're very excited about it.
Why Winnipeg this year?
You know what? We've done a lot of the other major Canadian cities, and we thought maybe we just want to do one right in the heart of the country. And so that's where we ended up. Yeah, it's going to be great. We're going to bring a little bit of color and excitement to Winnipeg for 3 days.
Amazing. And is a venue chosen so far?
Yeah, we're at the RBC Convention Centre, and just great place, really good people. We loved our site visits there. It's a good team. We're looking forward to it. It's going to be great.
And so for anyone who's never been to the CWIM conference before, give us a bit of an overview of what they can expect.
Yeah, I mean, the CWIM conference is super special. I'm a little bit biased, but I think anyone who's ever been will concur with that comment. This is going to be our 9th event. We started it in 2018. We had the idea for it about a year and a half before that. It was after the murder of Dr. Ilana Frick in Toronto. She was murdered by her husband. It was really awful. And the Canadian women physicians community that we had was really deeply affected by this tragic event. There had been an OIMA meeting shortly before where she was surrounded by her women physician friends, and then this happened a few days or so later, and it was just like so shocking. And so there was a feeling that we needed to get together, not just for her and to celebrate her, but so that this kind of thing maybe can happen a little less, like if we have this like strong community of support and an opportunity to reach out to each other and talk to each other and be around each other, communicate with each other better, then maybe we'll feel more empowered to speak each of our own truths and seek help, if we felt part of a strong community or a network. And so that's how it started, and it just totally blew up. Like, I think there was a huge need for it. The first year, we didn't know if anyone would come. We just thought we'd convince all of our girlfriends to come and we'd be okay, but it sold out immediately. It was in Ottawa, which is where we are from. Myself and my partner, Dr. Caitlin Schwartz, and a whole other slew of women physicians who helped in that first year. And then so it just grew from there. It literally has grown every single year. And we have kept the focus on wellness, which was always the goal. We always turn down talks about like osteoporosis or the new diabetes guidelines. We don't want to hear those things because that's what we do the rest of the year. But for that one weekend every year, we just talk about personal development, family, friendships, burnout, and all of the things that kind of recharge our batteries. And, sometimes we'll have a bit of champagne and some shopping in the exhibit hall, and then we head home feeling like our buckets are nice and full. And so we do that once a year together, and it's pretty special.
And how have you managed to keep that focus on wellness over the years? How has that changed since the first year towards now?
Yeah, it's a good question. At the beginning, it was really a question of us sort of sitting down, going through all of the comments on social media on our Facebook group of women physicians and sort of seeing where the pulse was and what people wanted to hear more about. And so that's sort of how we narrowed it down in the early years. It's much easier now, Jordan, because We get these are CME accredited events. They're real events, and we get real evaluations back from people, and we do a means assessment, a needs assessment, and people give us all of their feedback. People give us suggestions for speakers. So the team sits down every year, literally a week after the conference has ended, and we start planning for the next one and find appropriate speakers and topics, etc.
I guess, how do you keep it that way then? How do you keep it from turning into the more of that corporatized type of event that people are so used to attending?
I don't know if we know how to do that. We've never wanted to do that. It's easy. That's not the hard part, actually, for us. We're very focused on our mandate, which is keeping women physicians happy and energized and inspired. We juggle so many balls. I know male physicians do as well. They're different balls, but we know what's important for this demographic, and we have resisted any approaches towards shifting this to more corporate. Even, when it comes to the talks that have to do with your professional life, we have really tried to cover topics that you wouldn't hear about in other medical conferences. Like there was a huge hole, right? You and I have both been to a lot of medical conferences. I'm an ophthalmologist. We cover all of the medical stuff over time at those events, but there's like this massive abyss that no one talks about, not in med school, not in residency, not in fellowship, and certainly not as a staff physician trying to manage life. So that's not the hard part for us. We have a pretty good idea of what we need to do and what we're here for.
You hear so much about just wellness and, how do you combat burnout, all the different hazards, I guess, related to the occupation of being a physician. Like, it's just talked about so much in medical school, residency, all the journals and blogs. So it's really interesting to actually see a outlet for that, like action being done and people getting together to further these debates, these conversations.
Yeah, that's exactly why we built CWIM. Like, it didn't exist. Now there are, right? And I don't know, like, I'm at the Ottawa Hospital is where I work primarily. And most hospitals, I think, in Canada or North America have implemented wellness committees within departments, but also on a larger scale within their hospitals and within their LHINs. But I think there's something really unique about bringing together a demographic of women from across the country, all specialties and all provinces. And we all have the same issues and we all have the same problems and we all need the same kind of support. And at the time when we built CWIM, wellness was not as trendy as it is now. And so there was an even higher need for that kind of material. At first, it was hard to find speakers even for some of the topics. Now it's like they're everywhere because the need was recognized. But yeah, it's definitely something that was worthwhile to pursue. And we immediately recognized that by the response that we got to the initial conference.
And what's the reattendance like? I imagine you probably see a lot of similar faces every year, a lot of same friends coming back again and again.
Yeah, for sure. We do. We have like our hardcore CWIM fans. In fact, next year for our 10th anniversary, we're bringing it back to Ottawa for the first time. And we were just thinking we should recognize the people who've come to all 10 of them, because there is quite the cohort that just kind of follows CWIM around no matter where we go.
We gotta get like a special mug or something.
That's right. That's right, a special mug or something. But they come and then they bring their friends, which is why the numbers have really just gone up year to year.
Very cool. No, it must be like a really positive experience for, I don't know, anybody who's gone to any conference 10 times in a row. That's impressive.
Yeah, for sure.
How is the actual event structured? So we're going from June 11th to June 13th. What's different on the different days?
Yeah, so the first day, June 11th, is a little bit unique. It's not the main conference. The main conference is those last 2 days. The 11th is what we call workshop day. And so that has also morphed quite a bit from when we first started. But it is a day where you register for that day specifically, and you select 3 out of 9 workshops. So the difference between our workshop day and the actual conference is the workshop sessions are a bit longer and the group is smaller. So you're not in a room with 1,200 people. You're in a room with, I don't know, between 150 and 400 people. And you have a little bit more time with that expert speaker, and they will go into a little more detail, and they'll make you do self-work or group work at your table. You dive a little bit deeper into that topic. And so that full day on the first day, the 11th, will be our workshop day. And then we always have a welcome social event on the evening of the first day. And then off we go the next morning. Everyone shows up for the next morning, and then the room fills up and the tears start flowing because there's a lot of emotion in a room. It's very cathartic to be in that space.
What is the vibe like in general? Like, it's an all women event. There are dudes allowed. I understand that it does happen, so it's not an exclusive thing. But like, what is the vibe like in a gathering of such size with all one gender? That's got to be very unique.
Yeah, it is. And it's like nothing you can imagine. And in fact, it's like nothing I had anticipated either. The first time I walked into that room when everyone was sitting, I was overwhelmed. And it's like that every year. It's hard to describe it, but it's very much a feeling of family and camaraderie, despite not knowing everyone in there, or not even a tenth of the people in there. You can easily show up to this conference on your own, not knowing anybody, and leave with dozens of new, not just acquaintances, but people you would call your friends and that you would stay in touch with. You know, you're putting into a small space for 2 full days a group of people who not just have a lot of things in common, but have a lot of difficulties in common. And I think that's what makes it so special. That's what brings people together even faster.
Very interesting. And then it started out, how many people were at like the inaugural event?
150.
And so, I mean, that's still a pretty...
We ran out of space. Like we didn't think it was going to be that big. So we had only just rented a section of that venue. And so it sold out.
I was going to say, that's still a pretty large number of attendees, even just for the first one. How has the emotional changes evolved over the years then? I guess now that it's tripled in size, like, has that affected things? Does it seem different, better, or just otherwise any different now that it's grown so much?
Yeah, that's a good question. And that's something we have talked about a lot in the past. Like, we always thought we wouldn't ever want it to be too big because it changes the vibe. But honestly, last year in Calgary, it was so amazing. We had 1,200 in person, and it really just felt the same. It felt just as amazing. And being in that crowd, like being at the registration desk, watching all these women come, there's a lot of hugging and there's a lot of joy. And it's just, I feel like it hasn't taken away from how special the event is. The size hasn't really, I mean, we probably wouldn't ever want it to be bigger than 1,500, but we've said that before throughout the years. And then we're like, well, let's just see what happens. And this experiment has only ever been a positive one. And we have never regretted having that number of people in one space.
That's very cool. I mean, it's just interesting, right? Like, you have sort of the origination of it is kind of like a somber, solemn sort of cause behind everything, but then it turns into more of a celebration and joyous occasion.
And we do still, every year, we have the Elena Frick Memorial Lecture as part of our event. It's probably we choose one keynote every year to name after her, and it's always something of very high social, economic or social significance, or something that really touches all of our lives and our practices, our patients and ourselves. And so we will always continue to honor Dr. Frick, and we are in touch with her family, her parents, and her kids. We've watched the kids grow up, and it's really, her tragedy of her life led to something that has touched a lot of people in so many ways. And we get emails at the end of every conference from people telling us, they were on the verge of quitting their job or leaving their partner, or they were overwhelmed with parenting, and it just really gave them enough strength to try something new or seek therapy or keep going or whatever it is. Something good came of this event for sure.
Wow, that's super interesting. Just like how it affects people on such a profound, deep level.
Mm-hmm. And it's not even us. It's the group. We just put together these talks and we make it really pretty. I think people do love the aesthetic of our conference. Like, you will get a welcome bag like you've never had before, and we do make it. It appeals to women of our demographic, but that's not the big magic of it. The big magic of it is all the people who are there in one room supporting each other. I mean, you could be talking about banana bread and it would have the same effect. I think it's just like the feeling that you belong to this group of people that is so powerful. It's underrated.
Very cool.
Sure.
Well,
Attracting top healthcare talent is crucial for providing exceptional patient care, but connecting with the right professionals can be time-consuming and complex. Cherry Health bridges the gap. Our network allows you to showcase your organization, post jobs with precision and ease, and directly engage with healthcare providers actively searching for roles like yours. Whether you're an ambitious do-it-yourselfer or a seasoned recruiter, our intuitive web platform makes it easy to showcase your open roles and organize your applicants. Need a more personalized approach? Cherry Health Staffing Solutions offers dedicated recruiters to find and vet the perfect candidates for your specific needs. Build your dream team with Cherry Health. Visit www.cherry.health and start growing your team today.
of course, here's some of your favorite take-home messages, I guess, from the last previous year's events. Were there any things that really resonated with you in the talks or just the interactions with the other attendees?
Yeah, I mean, for one specific example, we had a speaker many years ago. It was maybe in like year 2. She was a bit of a comedian speaker, and she was on stage and she talked about this like power pose that she does when she's about to go into a meeting room, full of like very important people. And she made us all stand up and do this power pose. And it's so funny, Jordan, because like all these years later, I still think of her and I still see people at the CWIM conference every year who like remember her and are doing her power pose because they remember and they use it, I think and then if you're not looking for a very specific example, but just a generalization, one of the most beautiful things that I love about our conference is we're so open to, obviously, women with babies, and there's always dozens of babies that come along with their mothers. And we have a beautiful nursing room and we have space in the back, but you always see like a lineup of strollers, and then you see other women taking women's babies from them and like holding them during a talk. And it's just like, you don't know who the woman is who just wants to hold your baby, but you're happy to hand. So there's like this group of babies being handed around during one of the talks because everyone wants to like hold this woman's baby who she doesn't know. And it's just, that's how the conference feels. It's like this feeling of trust and mutual understanding. And really love of what we do, love for each other, love for children, love for our calling in life. And it's really fulfilling.
It sounds like an experience really like no other.
It truly, truly is. You should come. We'll let you come, Jordan. You can come.
Honorary man of the...
Honorary man. That's right.
As far as the speaker lineup this year, I don't suppose you're at liberty to drop any names of who's actually going to be talking about what?
I have to tell you, I think even without an agenda, people who know CWIM would register for the conference. But this year, one of the speakers, we have quite a few amazing speakers, but one that stands out for me is Dr. Anna Lemke. She wrote the book called Dopamine Nation. So she's coming to give a talk about this addiction to indulgence or dopamine. And then we have a talk by Dr. Pooja Lakshman. She's talking about real self-care and how it's not really about like bubble baths and juice cleanses. And we have a talk on tall poppy syndrome by Dr. Coach Callie. She's a physician coach. We have a talk on misinformation in medicine, and then a talk about legacy. We've got a whole range of different speakers for the main stage. It's going to be wonderful.
Okay, amazing. We'll have to put a link in there so everyone can check out the full lineup. And then what's going to be different this year compared to last year? What did we learn in the feedback or the comments afterwards? Anything markedly going to be different?
Yeah, the only thing we've changed in the structure of the event for this year is our awards. So we do have Inspiring Woman Physician Awards every year. And so we present between 3 and 5 awards per year to a woman who has made a difference, for example, in her community, in her hospital. And so we get a whole bunch of submissions every year, and then there's a selection committee. And usually the winners aren't told that they're going to win. So it's an emotional part of the event. So
Cool.
the way we've changed it this year is that we've spread the distribution of those awards out over the course of the 2 days rather than concentrating it. But other than that, everything is quite similar. Our gala is pretty magical. It's worked really well. We are always thinking about ways of changing it and if it's necessary. And right now, for the past, I would say 3 years, it's been pretty steady, holding steady and doing well. It's really amazing to get feedback from 1,000 people every year, because then we know what we need to shift. And right now we're just sitting in a really nice place where it's doing well. So we're not making any major changes for the time being.
That sounds like it's working. Out of curiosity, what are the categories or the...
There aren't any categories. It's just 4 Inspiring Woman Physician trophies that get handed out. And it's always for a different contribution.
I love that it's actually a surprise whenever it gets there. That's super fun.
Yeah, that's where all the emotions come out for sure.
To anyone on the fence thinking about coming, haven't actually bought a ticket yet, what would your advice to them be?
I mean, you have to try it to believe it. I don't know if we've ever had someone who's come and not want to come back. So it's that kind of a thing. You just have to jump in and believe what you're hearing about it and just come once and then you'll understand it.
Take the plunge.
Take the plunge. That's right. I'm I'm really grateful that we got to have this conversation about this amazing event. I do tell everyone I meet that it's the best medical conference in the world. I really, truly believe that it is. It doesn't exist like this anywhere else. There are some in the US, but much smaller than this one. This is just a really special place for women physicians to get together. And I appreciate you and Cherry Health having us on to talk about it. And I hope to see you there one day, Jordan.
I would love to go. One of these days, either in the exhibit hall or actually checking it out. It sounds like a really fun one.
Yeah, for sure. You would love it.
Well, Dr. Ziai, thank you so much for chatting with us today. Really appreciate you sharing a little bit more about the Canadian Women in Medicine and the upcoming events. I hope everyone checks it out. Check out the website.
Thanks, Jordan.